I knew she needed someone to help her. It seems like these people are friends when they first come in the door. And I think that's what I saw, that the emphasis wasn't putting on dying, it was putting on living, putting on, let's get through this, that we're going to be all right, we're going to help you.
Hospice is concentrating on quality of life. They must have a diagnosis that meets criteria, and that's a medical guesstimate of 6 months or less. And of course, that is usually decided upon with their primary care physician because they know them best. And as symptoms are not as well managed as before, that's when we can be considered. And then we come in and make sure that the patient has symptom management. And oftentimes they do so much better after their symptoms are managed. Studies show they live longer on hospice with symptoms managed well. So Janet is thriving, as you can see. And so that's when we want to get patients on hospice, not when they just have a few days or weeks left. And oftentimes we get them when they are in their dying state. So this gives us opportunity to help a family for many months rather than just days or weeks. So this is an optimal time that you have chosen this kind of care. And as you can tell, I'm blessed to be in here with this quality of family and of Janet's sweet demeanor and Bob's awesome support and the family support of both of them. I'm the blessed one that gets to come into this home weekly and make sure that she's as comfortable as she can be. Yeah, we all, as we age, we all will have a condition that deteriorates. And that's either congestive heart failure, a cancer condition, a dementia condition, a neurological issue, strokes. So when those symptoms are not able to be tweaked or managed with any improvement with a primary care physician, or when it's challenging to manage those symptoms, that's when a primary care physician could think about hospice, where a family member could call us and ask, hey, can we receive your help? You know, we need help to manage this condition, and please come and see us and meet us and see what you think, and we can be there to do an assessment.
Things that we didn't know we needed to do, they did for us. They had it all, I think it was, from the doctor's office and their coordination with hospice. They got the bed in there for us. They got the meds for us. Then they, told us how to administer the meds. Then they came and they did the care for him, the cleaning. Mm-hmm. So I felt like the connection between the doctor's office and hospice was just on point because we didn't have to do anything. We didn't have to make any other kind of phone calls. It just was done for us.
Angels.
Yep. No wings.
Yeah, they were fantastic.
Yep, they were. As soon as she passed, they took care of calling everybody that needed to be called.
Yep. People that show up with hidden angel wings and take care of everything. It's just absolutely fantastic. I'm unaware of a negative stigma. Because if there is, there shouldn't be.
I would hope that someone would say this is for care. It's not for death. Mm-hmm. It's more for life and care.
Yeah, caregiving to a dementia patient, loved one, wife, is extremely difficult. It taxes the family and the primary caregiver, like Bob, tremendously. So it's so rewarding for me to manage behaviors with terminal illnesses because it just allows for quality of life and it gives the family much support. So that's why I keep doing it after 17 years. I just love symptom management and what it means to family members and to patients like Janet. So Janet and I go for walks. We go and look at her daffodils that are coming up, and we go down the road to look at Amy's house. We never found it that one time. Just like, it's down there. I had the wrong shoes on though, so we had to stop and just talk. Yeah. But yeah, you do not need to be in the house, and you do not need to be homebound. You can take vacations. You can go visit family members. We want you to go to the reunions and the birthday parties. We want that because that's quality of life. But again, we want to take care of you now, your family member now, so we can manage those symptoms and they can have a better quality of life and make it easier on the caregivers, on the family, to have a team of people that will help them.
The things that I see is, like I said before, I was coming in and trying to mop the kitchen floor and do all the stuff, and I didn't get to enjoy my mom and dad. And I would see that every time I go home. I'm like when I go, I have to do X, Y, and Z, and then I'm missing out on the little things that we get to do, taking little trips or drives to go get a orange high C at McDonald's, or I was missing that because I had to get the laundry done, clean and mop the floor, and Mom would help me and we'd try to have that connection, but I was missing out on my parents because I was trying to do all the stuff that they needed help with. And so now, with some light cleaning and stuff, I get to spend time with them.
A lot of times with symptoms well managed, they may live for years. And we've had patients that's lived on hospice for 2 to 3 years, because every recertification period, which is 2 or 3 months, depending where they are in the process, they still meet their criteria, the hospice Medicare criteria to continue. They still meet the criteria for their specific disease process. So oftentimes we have them for a long time. They can always choose to go off of hospice, but honestly we don't have that very often because the people, the patients and the family, the caregivers, really enjoy having nurses coming to them to help them with their terminal condition.
And I think that's where hospice is. They're not just here in the last days. I feel like she's going to be here for Dad 2 years from now, checking in. That's what hospice is. And I didn't know that.
But those were moments where they were that calming reassurance that we needed, that we didn't know that we needed. And it was a carryover from leaving the doctor's office into our home. And that's where I said, it's not clinical. It's not, someone giving you this outcome, this diagnosis, the prognosis. It's this real life conversation that, they're able just to give us that support that we needed in that moment. So
You don't get that in Indianapolis. You're not going to get that in a big suburban hospital. You get that at Schneck.
Mm-hmm. Mm-hmm. It's the people.
Yeah, 100%. If you think hospice is going to be a difficult decision, it is. But understand, on the back side of that, hospice is actually the single greatest thing you can do at that critical point in time for your loved one, in my opinion. And if you trust the people at Schneck with all of the medical care that leads up to a hospice decision, continue to trust them. Just continue to trust them.
We know we're going to die. Everybody's going to die. It's just the way it's going to be. But let's talk about what we're doing while we're here. And that's what they kind of brought to our family.